Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into a topic that touches the hearts and sometimes tests the patience of millions of dog owners around the world: separation anxiety. For many, the image of a dog with separation anxiety is one of a chewed-up sofa or incessant barking reported by unhappy neighbors. But this picture, while accurate, is incomplete. Separation anxiety is more than just mischievous behavior when you're out of the house. It's a genuine state of panic, a behavioral disorder rooted in profound distress that can severely impact a dog's welfare and strain the very bond we cherish with our canine companions. Imagine a world that feels safe and predictable only when one specific person is present. Now, imagine that person leaves. The certainty vanishes, replaced by a rising tide of fear and uncertainty. This is the daily reality for a dog with separation anxiety. In extreme cases, these dogs have been known to crush doorknobs with their teeth or even launch themselves through plate glass windows in a desperate attempt to reunite with their owners. This isn't a dog being bad or spiteful, this is a dog in a state of crisis. So, in this episode, we're going to unpack this complex condition. We'll explore what separation anxiety truly is, why it happens, the critical importance of a correct diagnosis, and the comprehensive, multifaceted approaches to treatment. From established behavioral strategies to cutting-edge therapies that are changing the way we manage this disorder. Whether you're a veterinarian, a dog owner struggling with this very issue, or simply someone who loves dogs, this conversation is for you. Part 1. Defining the distress. To truly understand separation anxiety, we first need to get a handle on a few key terms: anxiety, fear, and phobia. While we often use them interchangeably, they represent different emotional states. Fear is an alarm that sounds in response to a present or imminent danger, like a dog seeing an unfamiliar, imposing figure approaching. Anxiety, on the other hand, is the anticipation of a future or imagined danger. It's the feeling of dread about what might happen. A phobia is an excessive and persistent fear of a specific object or situation, one that's blown way out of proportion to the actual threat. In clinical practice, the lines can be blurry. When we talk about canine separation anxiety, we're using it as a catch-all term for the distress a dog experiences when left alone or separated from their primary attachment figure. This distress can manifest as anxiety, pure fear, or even a phobic-level panic attack. The signs are often unmistakable to a returning owner. The most common ones include destructiveness, which is frequently focused on points of exit like doors and windows, as if the dog is trying to dig or chew its way out to find you. Another hallmark is inappropriate urination or defecation in a dog that is otherwise perfectly house-trained. This isn't a lapse in training, it's a physiological response to extreme stress. Then there is distress vocalization, the barking, whining, or howling that can go on for hours, and hypersalivation, where owners come home to find puddles of drool. However, some of the most telling signs are invisible to an owner who isn't there to see them. This is where video cameras have become an indispensable tool. Video analysis of dogs with separation anxiety reveals they often spend a significant amount of time in states of hypervigilance. They may be pacing restlessly, panting, circling, or remaining stationary, but with their senses on high alert, constantly scanning and listening for any sign of their owner's return. This is in stark contrast to dogs without separation anxiety, who spend the vast majority of their time alone in a state of passive rest or sleep. This behavior of constantly being oriented to the environment is a crucial diagnostic clue that can only be captured on video. The key to all of this, the defining feature, is that these behaviors occur only during real or even just perceived separations from the owner. And this is not a rare problem. Surveys in the United States have found that about 14 to 17% of dogs receiving veterinary care show signs of separation anxiety. In the United Kingdom, some estimates suggest that while at least 20% of dogs have the condition, up to half the dog population may show clinical signs at some point in their lives. For veterinary behavior specialists, cases of separation anxiety can make up a huge chunk of their caseload, anywhere from 20 to 40%. Part 2. The ripple effect on dogs and their humans. The impact of separation anxiety extends far beyond a damaged door frame. For the dog, it's a serious welfare issue. Living in a state of recurring panic takes a physiological toll. While not studied specifically in dogs with separation anxiety, we know that long-term stress in dogs, in general, can lead to a host of problems, including suppression of the immune system and chronic gastrointestinal issues. Some dogs may even cause themselves physical harm or self-trauma in their frantic attempts to escape confinement or in their agitated state. For the humans in the equation, the disorder can be just as devastating. It has an erosive effect on the human-animal bond. Owners often report that their dogs are perfect 95% of the time, which makes the 5% of chaos and destruction all the more frustrating and heartbreaking. They grapple with feelings of guilt for leaving their dog, frustration over the financial cost of repairs, and emotional exhaustion from watching their beloved pet suffer day after day. This stress can become a major point of conflict within a family, leading to marital disharmony or intense arguments about what to do with the dog. Tragically, this strain can become so great that the bond breaks entirely. Separation anxiety is one of the leading behavioral reasons that owners relinquish their dogs to animal shelters. And for a dog already struggling with being left alone, the shelter environment can be unimaginably stressful. In the most severe and seemingly intractable cases, some owners feel they have no other option but euthanasia. This represents the ultimate paradox of separation anxiety. A condition born from a powerful attachment can ultimately lead to the dissolution of that very bond. Part 3. Untangling the roots of separation anxiety. So why do some dogs develop this debilitating condition while others are perfectly content to nap on the sofa when left alone? The truth is, there is no single, simple answer. The development of separation anxiety appears to be multifactorial, with a complex interplay of a dog's history, genetics, and environment. Several factors have been reported to be associated with the condition. A history of significant changes in an owner's routine is a common trigger. This could be a move to a new house, a sudden change in a work schedule that leaves the dog alone for longer periods, or the loss of a family member or another pet. Even periods of intense, constant companionship, like an owner recovering from surgery at home, followed by a sudden return to a normal work schedule, can predispose a dog to distress. A dog's background also plays a significant role. Many dogs that exhibit separation anxiety have been adopted from animal shelters or rescue organizations. In one study, dogs presented for separation anxiety were more than 3 times as likely to have come from a shelter compared to dogs presented for general medical issues. Their early life history is often a mystery, but it's possible these dogs had disruptive early experiences, such as inadequate socialization, or were even the offspring of dogs that also exhibited separation distress. The modern human lifestyle may also be a contributing factor. Single-person households are on the rise, and in one study, dogs from these homes were 2.5 times more likely to show signs of separation distress. Long work days and limited opportunities for dogs to socialize with other dogs may also play a part. For a long time, the prevailing theory was that separation anxiety was a direct result of hyperattachment, a term used to describe an excessively strong, dependent bond with an owner. These are the so-called Velcro dogs who follow their owners from room to room and need constant physical contact. While this pattern is common in many clinical cases, it's not a universal feature. In fact, research using a standardized attachment test found no significant difference in how much time dogs with and without separation anxiety spent in close proximity to their owners. Some researchers now suggest that instead of hyperattachment, these dogs may actually have an insecure attachment style. They may not be overly affectionate when their owner returns, but instead remain agitated and difficult to calm down. This variability in presentation has led to more nuanced models of the disorder. One proposed model divides separation distress into 3 types. Class A dogs fit the classic hyperattachment profile, becoming anxious at departure cues and showing intense greetings upon return. Class B dogs, however, are not hyperattached to a person, but may be distressed by the loss of other comfort stimuli when left alone. Finally, Class C dogs may have an underlying fear or phobia that is the primary issue, with the attachment to the owner being a secondary coping mechanism. This highlights that we can't treat all cases as if they stem from the exact same emotional root. Part 4. The critical need for a correct diagnosis. Before starting any treatment, a correct and thorough diagnosis is absolutely essential. Misdiagnosing separation anxiety can lead to ineffective treatment plans and prolonged distress for both the dog and the owner. The first step is to rule out underlying medical conditions. A dog who suddenly starts urinating in the house when left alone might not be anxious. They could have a urinary tract infection, diabetes, or another endocrine disorder that increases urine volume. Similarly, gastrointestinal issues could be the cause of inappropriate defecation. A full medical workup is especially important in geriatric patients or in any case where house soiling is a primary complaint. Next, it's vital to rule out other behavioral problems that can mimic separation anxiety. A young dog might simply be destructive out of boredom or a lack of exercise. A dog that was never properly house-trained will have accidents whether the owner is home or not. Perhaps most importantly, it's crucial to distinguish separation anxiety from a noise phobia. A dog might be terrified of thunderstorms, construction sounds, or fireworks. If these noises happen to occur while the owner is away, the resulting destructive or panicked behavior could easily be mistaken for separation anxiety. A careful behavioral history is needed to tease these possibilities apart. This brings us back to the most important diagnostic tool we have, video. As we've discussed, owners, by definition, cannot witness their dog's behavior during a separation. They only see the aftermath. A recent clinical trial evaluating a new treatment device highlighted this perfectly. Many dog owners who believed their dog had separation anxiety submitted screening videos, only for the videos to show that their dogs did not meet the criteria for the diagnosis. This suggests that without video evidence, dogs may be frequently misdiagnosed. Video provides objective, undeniable evidence of the dog's emotional state when alone. It allows a veterinarian to see if the distress behaviors begin immediately after departure, to quantify how much time is spent pacing versus resting, and to identify that subtle but significant state of hypervigilance, the orienting to the environment, which is a key indicator of anxiety. It is the single best way to confirm the diagnosis and, as we'll see, to monitor the success of any treatment plan. Part 5. The Road to Recovery, a Holistic Treatment Plan. Once a diagnosis of separation anxiety is confirmed, treatment should begin immediately. This is not a problem that typically resolves on its own. In fact, without treatment, about a third of cases may actually worsen. The good news is that with appropriate intervention, 60 to 80% of cases show improvement. A successful treatment plan is almost always a combination of strategies, including owner education, environmental management, behavior modification, and, sometimes, therapeutic agents like medication. First and foremost is owner education. It's crucial for owners to understand that their dog's behavior is not driven by spite or anger. Punishing a dog upon returning home is not only ineffective, as the dog cannot connect the punishment to an action that happened hours ago, but it can also worsen their anxiety, as they now learn to fear their owner's return. Next is environmental management. In the initial stages of treatment, the goal is to prevent the dog from experiencing the full-blown panic of being left alone. This might mean arranging for doggy daycare, a pet sitter, or having the owner take the dog to work if possible. This management stops the dog from rehearsing the anxious behaviors and gives the household immediate relief from the destruction and stress, which in turn allows time for the other parts of the treatment plan to take effect. Confinement to a crate can be a useful management tool for some dogs, but it can be a disaster for others. If a dog is not properly crate trained or has confinement anxiety, being crated can dramatically worsen their panic and lead to self-injury as they try to escape. The cornerstone of treatment is behavior modification. The overarching goal is to foster independence and change the dog's emotional response to being alone. This is often broken down into 3 phases: what to do when you are home, what to do before you leave, and what to do when you return. When you are at home, the focus is on rewarding calm and independent behavior. If a dog is particularly clingy or hyperattached, owners are coached to gently ignore attention-seeking behaviors like nudging, whining, or jumping up. This doesn't mean ignoring the dog altogether. Rather, attention is given on the owner's terms, when the dog is calm and settled. Owners can also practice exercises that teach the dog to be comfortable with distance, such as a downstay on their bed while the owner moves around the room and eventually leaves the room for short periods. Preparing for departure and returning home should be as low-key and unemotional as possible. Long, dramatic goodbyes and ecstatic, high-energy greetings can heighten a dog's anxiety around these events. The recommendation is to ignore the dog for about 30 minutes before leaving and to ignore them upon returning until they have calmed down completely. A great strategy is to provide a very high-value, long-lasting food puzzle toy, like a stuffed Kong, only when you are leaving. This can create a positive association with departure time and keep the dog occupied during the initial, most stressful period after you've gone. Another key technique is to desensitize the dog to departure cues. Dogs with separation anxiety are masters at picking up on the signals that you're about to leave, picking up your keys, putting on your work shoes, grabbing your purse. These cues can trigger anticipatory anxiety long before you even walk out the door. To counter this, owners should practice these actions throughout the day without actually leaving. Pick up the keys and then go sit on the couch. Put on your coat and then make dinner. Over time, these cues lose their power to predict a stressful departure. Part 6. The Role of Medication. For many dogs with moderate to severe separation anxiety, behavior modification alone is a very slow process. This is where psychoactive medications can play a vital role. The goal of medication is not to sedate the dog, but to reduce their underlying anxiety to a level where they are calm enough to learn the new, positive associations that the behavior modification plan is trying to teach. There is some debate in the veterinary community about when to introduce medication. However, several large-scale studies have shown that a combination of medication and behavior modification yields a faster and more significant improvement compared to using behavior modification with a placebo. While behavior modification alone can be effective over many months, many owners are at their breaking point when they seek help. Shortening the time to a noticeable response can make all the difference in keeping a dog in their home and preserving that crucial human-animal bond. From a welfare perspective, quickly reducing a dog's daily distress is also a primary goal. The two medications approved by the Food and Drug Administration in the United States for canine separation anxiety are clomipramine, which is a tricyclic compound, and fluoxetine, a selective serotonin reuptake inhibitor, perhaps better known by brand names like Clomicam and Reconcile. In clinical trials, both drugs, when combined with a behavior management plan, proved to be significantly more effective than a placebo combined with the same plan. For example, in one major study, 72% of dogs treated with fluoxetine and behavior management improved, compared to only 50% of dogs who received the placebo and behavior management. Treatment with these medications is typically continued for at least 2 months after a satisfactory response has been achieved, at which point a gradual weaning process can be attempted. The behavior management program should be continued throughout this process. Some dogs may relapse and need to resume therapy, and some may require lifelong medication at the lowest effective dose to manage their anxiety. Part 7. New Frontiers in Treatment. The science of animal behavior is constantly evolving, and in recent years, exciting new non-pharmacological treatments have emerged, offering new hope for dogs with separation anxiety. One of the most promising is a technology called pulsed electromagnetic field, or PEMF, therapy. PEMF therapy has been used for decades in both human and veterinary medicine for things like bone healing and pain management. It involves using a device to create a low-level magnetic field that can modulate the activity of nerve cells. Recently, researchers began to explore its potential for psychiatric conditions, including anxiety. A recent landmark study, published in 2021, conducted a randomized, double-blind, placebo-controlled clinical trial on a handheld PEMF device called the Calmer Canine. In the study, 40 dogs with moderate to severe separation anxiety were enrolled. Half the dogs received a real, active device, while the other half received an identical-looking sham device that did not produce an electromagnetic field. Owners, investigators, and even the study statisticians were all blind to which group each dog was in. Owners treated their dogs twice a day for 6 weeks and submitted videos of their dogs left alone at the start of the study, at week 4, and at week 6. The results were fascinating. When looking at owner-completed questionnaires, there was no significant difference between the two groups. Both groups showed improvement. This is a classic example of what's known as the caregiver placebo effect, where owners who believe their pet is receiving a treatment report positive changes, even if the treatment is a placebo. This has been seen in many veterinary clinical trials, including the original trials for both fluoxetine and clomipramine. But the video data told a different story. The objective, coded videos showed that the dogs treated with the active PEMF device had a significantly greater reduction in negative behaviors associated with anxiety by week 6. Furthermore, when success was defined as a 100% or greater increase in positive behaviors like resting calmly, the active device group had a significantly higher percentage of successful outcomes. This study provides strong evidence that this PEMF device is a safe and effective treatment, offering a valuable tool for owners who may be looking for a non-drug option or for dogs who haven't responded well to medication alone. Another area of intense scientific interest is the role of the hormone oxytocin. Often dubbed the love hormone, oxytocin is a neuromodulator that plays a key role in social bonding, maternal behavior, and affiliation in mammals, including humans. A growing body of research has shown that oxytocin is also fundamental to the human-dog bond. Positive interactions such as petting, friendly talk, and even mutual gazing can increase oxytocin levels in both the dog and the human, creating a positive feedback loop of attachment. Given its role in social bonding and its use as a supplemental treatment for anxiety disorders like social anxiety disorder and post-traumatic stress disorder in humans, the question naturally arises: could intranasally administered oxytocin be used to treat separation anxiety in dogs? Studies have already shown that giving dogs intranasal oxytocin can increase their affiliative, or friendly, behaviors toward their owners and other familiar dogs. However, the science here is complex and researchers urge caution. The effects of oxytocin are highly dependent on context and individual history. It's not a simple cuddle chemical. The critical, unanswered question is whether boosting oxytocin would make an anxious dog feel a greater sense of security that persists even when their owner leaves, or if it would heighten their sense of attachment so much that the subsequent separation becomes even more distressing. It's also possible that a dog with a history of difficult early life experiences could have a negative or anxious response to oxytocin administration. So, while the idea is tantalizing, much more research is needed to understand the intricate effects of this hormone before it can be considered a viable treatment for separation anxiety in dogs. In conclusion, as we've journeyed through the world of canine separation anxiety today, it's clear that this is far more than a simple case of a dog missing its owner. It is a complex behavioral disorder with profound implications for the welfare of dogs and the emotional well-being of the people who love them. The key takeaways are clear. Separation anxiety is a legitimate panic disorder, not a training or discipline issue. A correct diagnosis is the crucial first step, and this diagnosis should be built on a foundation of a thorough medical workup and, most importantly, objective video evidence of the dog's behavior when alone. Treatment requires a patient, compassionate, and multi-pronged approach that combines environmental management to prevent panic, a consistent behavior modification plan to build independence and confidence, and, for many dogs, the judicious use of medication to facilitate learning. And now, with innovative and rigorously tested therapies like pulsed electromagnetic field devices becoming available, veterinarians and owners have another powerful, non-pharmacological tool in their toolbox. For any owner listening who is currently navigating this challenging journey, please know there is hope. With a proper diagnosis and a comprehensive treatment plan, the vast majority of dogs can find relief from their anxiety, and the beautiful, powerful bond you share can be restored. Thank you for listening. The titles for the referenced papers are in the video description. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.